Thanks for joining us. We're standing by to take you live to Prime Minister Anthony Albanese, who's talking in Cambodia. But in the meantime, back to one of our top stories, and the 800 COVID cases are among 4,600 passengers and crew who have come ashore from a cruise ship. Joining me live is infectious diseases paediatrician Professor Robert Booy. How are you this afternoon, Professor?
Well, thanks. Good to be with you.
Well, here we go again, a cruise ship, a lot of infections. Certainly it goes on and on again, but we've got a lot of immunity around the country. What is the difference that we're seeing now?
Well, cruise ships are petri dishes. They are places where multiple people spread infection, and it's not unusual to have a major outbreak of flu or another virus, norovirus. And so COVID, it's not surprising, but the largest proportion of the public ever have got a combination of natural and vaccine-induced immunity. It's called hybrid. It's a combination. It gives immunity in the nose and the rest of the body as well. So we're hearing reports that people are infected, but they're not seriously infected. And I haven't heard about hospitalizations yet. So I'm encouraged that people are prepared well by getting vaccinated. And if you are symptomatic and you're worried, contact your GP because you can get antivirals.
Absolutely. And we are hearing that, some schools are saying if you do have COVID, it's not a mandatory rule, but they suggest, especially if you are symptomatic, to stay at home for 5 days. We're hearing potentially, new rules, including mask wearing and so forth. What are your thoughts?
Well, the sensible thing in schools is for anyone who's symptomatic to stay home for 2, 3, 4, 5 days until they're better. So if they're better at 3 days, they're able to come back to school again. We want to promote kids at school. Their education, their socialisation needs it. Masks continue to be useful, especially for the vulnerable, the people with major medical problems, with elderly immune systems. People benefit by still being able to socialise, but to approach others with mask, and then that encourages others to be careful, to socially distance. So masks have a role, especially for protecting the vulnerable.
Tell us about this strain, and are the vaccines that we have been using able to help with this particular strain?
Well, there's a soup of subvariants. There's literally hundreds, but there's a handful, which are QBB.1, B.R.1.2, B.Q.1.1. All they are is variants of Omicron. They all cause the same type of symptoms, and the immunity is slightly down because for them to have survived and to transmit, they have to evade immunity. So they are still causing infection, but mild infection in vaccinated immune people. And that breakthrough can occur even more so if it's 6 months or greater since you were last immunised. So get that booster if you haven't had the third one, or if you're a vulnerable person, get the fourth one, because that will make a real difference. If you haven't had the fourth dose within the last 6 months, that will improve your protection.
And what about long COVID? Is it too early to tell with this particular strain the effects of long COVID, or are we seeing it overseas and learning from there?
It's almost certain that there'll be long COVID with these new strains. They're subvariants. I take almost pleasure, from the idea that given that we haven't had a new variant for a whole year, the virus is running out of ways to mutate and to escape our immunity. So we're slowly trapping it in the corner and getting on top of it. So that's what I think is important.
Talk to us about the patches, because I know you've been working on the vaccination patches. Tell us all about that.
There's great benefit to children, especially, from not getting a needle. If you can use a patch to deliver the vaccine without pain and potentially without needing a cold chain as well, so it doesn't even need to go in the fridge. So there are studies being done right now looking at the acceptability of patches to children, which you imagine is a no-brainer, and soon to look at the immunogenicity, the protective likelihood of putting COVID on a patch. Right now, only this week, we've started vaccinating adults with a patch as a booster against COVID. So that's really quite exciting. We'll have results early in the new year. That's Queensland technology, Australian work, and I'm excited to be associated with it.
And getting back to the cruise ship, 800 cases of COVID. I believe they had rats, not PCRs, and we know that rats are not as effective in detecting it. So potentially there could be a lot more of those COVID cases. What do you think about that?
Well, this is definitely a super spreader event. People going home with symptoms should just isolate and get better on their own in their homes, divided off from other members of the family in different parts of the house. It's not a good idea to go out in public if you're symptomatic. If you really need to, then wear a mask and keep it as short as possible. But there's going to be hundreds of people going into the community and with a tremendous potential for super spreading. And so we need to use the best practical approach we can, and that includes isolation, masks, and social distancing.
All right, we've heard it a lot, haven't we? But yes, it's still around. Thank you, as always, for your time and expertise. Infectious diseases paediatrician Professor Booy. Thank you. Take care.
Thank you.